At this time, I'd like to turn today's program to Canada Health Infoway. The floor is yours.
Thank you, Nikki, and welcome everyone. This is Fraser Rochford with Canada Health Infoway, and I'm joined by my colleague Simon.
Hello.
And we're very excited to have you all on the line today to announce our award recipients of the Data Impact Challenge. Before we get to the exciting news, let's just first review some housekeeping for everyone. First of all, I know there was a change in number, so those of you who are on the call, good. You got the email and you're using the right call-in number. For those of you that are on the, just seeing the WebEx, hopefully you'll see this slide and realize that you may be using the wrong call-in number, but hopefully you're on the right path. Just to let everyone know, this call is being recorded, and so we're just recording it for future purposes, and anyways, most of it is going to be Infoway speaking, but we just wanted to acknowledge that it is recorded. Let me give you a bit of background about Infoway. Many of the callers on today who are participating today are sort of first-time listeners to one of our webinars, so just wanted to give you a bit of an overview of Infoway. Infoway's vision, healthier Canadians through innovative digital health solutions, and we certainly think that the Digital Impact Challenge, or the Data Impact Challenge, was a very innovative way to seek new information about some of the questions that we pose that are questions that the health system is grappling with. Our challenges, we've run 9 challenges at Infoway since 2011. Each challenge has been slightly different, ranging from ideation challenges to outcomes challenges. And as part of our Impact series, the Data Impact Challenge was again exploring an innovative method of sharing findings to important health questions. We couldn't do this alone at Infoway, and we have a whole team behind us. And I'd like to acknowledge all of our supporting organizations across the country that help provide advice and guidance with all of our challenges. A special thanks needs to go out to the Canadian Institute for Health Information, Canadian Association for Health Services and Policy, and Choosing Wisely Canada, as they specifically on this challenge help with formulating the questions and providing many of the judges that reviewed all of the submissions. I'm going to turn it over to Simon to specifically talk about this challenge and its purpose.
All right, thanks very much, Fraser. So, we had a couple of reasons that we ended up taking on this particular challenge. One was that we had a couple of outstanding questions that had come up through our evaluation work, and some that had come from our supporting organizations, things that they were looking for answers to, and didn't have the data available to answer those questions. So that was one of the drivers, and the other one was that we realized that this challenge mechanism had the potential to maybe be a model for matching people that need answers, that have questions that can be answered through data sets, with those people out across Canada that work with those data sets, and find a way to match those people that need answers and people that have the data to actually answer those questions. So that was the driver for the challenge, and that's what launched us on this journey a couple of months ago. So I'm going to share with you now the results at a glance, just what we've found overall in the course of the challenge. So we had 6 questions in this challenge, and one of them, the last one, was the Choosing Wisely Canada question, which had a number of parts to it. We basically set out there with 6 things we were looking to try and answer. We gave people 64 days to answer these questions, and as you'll hear in the rest of the presentation, speed was a really important part of this. We wanted to find out if there were mechanisms by which we could get quick answers to questions, because we know that often policymakers and other decision makers in the healthcare system are looking for information quickly. So it was a tight time frame to do this work. Now, 41 submissions was a fantastic number to come in. We were really excited to see that many teams enter. 25 teams entered, making 41 submissions. Really exceeded our expectations. And I think we were also very impressed with the high quality of submissions that we received. So these were 41 teams that really took some time to do some excellent analysis. And we were really thrilled with the diversity of those submissions. So great geographic diversity, submissions from across the country, great diversity in terms of the types of organizations, from primary care organizations, research organizations, hospitals, organizations that manage different kinds of data sets, all jumped in and played in the challenge. So really exciting. I'm pleased to tell you that all of those 41 submissions are up and available on our website. So we'll be continuing to encourage folks to look at the Imagination Challenges website, at the site for the Data Impact Challenge specifically, and you can find all of those 41 submissions there. Big part of this challenge was about not only sourcing that information, but making it publicly available. So they're out there for viewing. Last important result was the judges. So we had 35 judges and a really excellent judging panel. And the list of judges is also available up on the website. A great group of folks, and really pleased that they committed their time. I know a number of them are on the line now, so thank you so much for the time you put in. One of the great things about having that many judges was we were able to have each of those 41 submissions reviewed and scored by between 5 and 7 judges. So it means that we got a really good set of eyes on each of those submissions. We're really able to assess the quality and compare submission to submission. So now I'm going to turn it back over to Fraser, who's going to talk a little bit about some more of the submissions and the speed.
Right. Well, and I think, Simon, before we leave this slide, it's important to, although we are announcing specific award recipients today, we consider all of the 26 teams who submitted the 41 submissions to be golden in our eyes. Everyone worked hard, and we want to acknowledge that effort. So although you can't see it, everyone on this webinar today is putting their hands together and saying, good job, all you teams that participated in this challenge. And I think we've really got some data now that we can work with, and so that Canadians can work with to show some answers to some of those questions. Simon made an interesting point around that speed was an actual factor, and as I started off my talk in saying that we've run 9 challenges at Infoway, typically we see in all of our challenges that a significant number of the participants wait till the final days to make their submissions. Often that can be over 2/3 of the participants in the final 2 days. And so when we were designing this particular challenge, we decided to add a speed component to the challenge. And so we wanted to not only see, can we get great results, but how quickly can those results come in. As you can see by this little graph here, some teams definitely stepped up to the plate and submitted quickly, where we still do have a number of teams that were submitted near the end. However, for our awards, there was a speed component to the awards. We certainly had reaction to that, and so we'll take that under advisement in that, part of our goal was speed on this one, but if we were to do the future challenges again, we'll certainly reconsider that speed criteria.
So just a comment or two on the reaction from the judges. We did get some great feedback from our judges, and I think just a few quotes here that reflect that. But the gist is, I think the judges found it to be an interesting experience. They learned a lot, and I think we had judges who were surprised to see the kind of quality of work that could come in such short time frames. And again, a huge thanks to the judges. So we've only got one more slide before we actually get to sharing the awards. But I do want to give you a bit of an overview of the data that we've seen come in, and give you a bit of a flavor of what's in those submissions that you can see if you look online now. Right now, for the lab question, the first question involved, which is how often do patients receive repeat lab tests within 90 days? We received 6 submissions for that, so it was one of the top answered questions. And you know, the obvious question in our minds at the end of this is, from these 6 submissions, do we have a reasonably good sense of what the rate of lab duplication really is across Canada? And when we look at these 6 submissions, we've got 4 jurisdictions represented. We have over 125 million tests represented. The first one came in really quickly, within 2 weeks. So a reasonable data set to work with. When we look at all these 6, we see quite a wide range when you look at them overall, but we have a top and the bottom of the range of 6% at the bottom and 41% at the top. And we start looking at the scopes of the analysis and the kinds of data and settings that were included, and realize that we have some outliers there. And so taking off the 6 and the 41% as outliers and just looking at the tight range in the middle that looked at the same broad scope that the question had indicated, what we see is a really nice range that starts to emerge there between 13 and 19%, and the submission with the broadest scope and the most tests included at 17.5%. So what our feeling was on this particular question, we are really starting to provide an answer and get into a nice range about what that level of lab repeat is in Canada. I'm going to talk a little bit more at the end about how we plan on further investigating this, but I wanted to give you a bit of a flavor of what you'll find as you start investigating some of those submissions. So without further ado, I'm going to turn it back over to Fraser, and we will start our announcements.
So the big drum roll around our first place award. Again, when it came to judging these awards, our judging panel reviewed all of the submissions, and they rated a portion of it, and the rest of the portion of the points went for how quickly you were able to submit your response. And so this first place award goes to Western Pirates from London, Ontario. The ISIS team there was our first place award recipient. ISIS, good job. I'm not sure Ahmed was indicated that he was going to be joining us on the call. Ahmed, are you there? Well, unfortunately, I guess Ahmed's celebrating in a beautiful sunshine day today. And so we congratulate the people at Western Pirates. Good job. So they had both, speed and agility is what we say. But we're now going to move on to our runner-up award.
Great. So we had 5 runner-up awards, and these are presented in no particular order. So the first runner-up award we've got is for A2I from Halifax. And I think we've got Raza and Ashraf on the phone.
Yeah, hi.
Hi. So we've got a question we'd like to ask you about your experience. So our question for you is, what advice would you give people who need answers to questions like those asked in the challenge?
Well, first of all, thanks for the opportunity to respond to such an interesting challenge. The advice that we have is around both operational and technical aspects. In operational aspect, I think know your data and make sure that you have the right data. So that is sometimes as a given, but once you start your analysis, then you realize you don't have the right data. And the second advice with respect to the technical aspects is try to use methods that are beyond the statistical approaches, such as looking at predictive analytics using data mining and model building approaches. I think that would give you a much broader and deeper analysis of the data, and you'll be able to answer questions in a much more rigorous fashion. Thank you.
That's excellent. Thanks so much, and really great advice. And I forgot, Raza and Ashraf, would you mind just summarizing the members of your team and just give us a really brief summary of your team?
Sure. In our team, it was an interdisciplinary team, so it was led by Ashraf Abu-Sharik, who is a data specialist and has a startup company which is A2I Solutions. Myself, I'm an academic. who works in health data analytics, and we also have another academic, both of us are at Dalhousie, Samuel Stewart. Then we also had 3 members from the pathology lab who were instrumental in making the data available and helping us in understand the data for us to do the analysis.
Excellent. Thanks so much. Really appreciate your submission. Congratulations.
Thank you.
So moving on with our next runner-up award. Drum roll, please. And this award goes to the Avengers. So congratulations, Avengers, for being I'm going to ask Jagadish to introduce. We can see the different team members here in this picture, but Jagadish, if you could please introduce your team, and we'll go from there.
Hi, this is Jagadish. Thanks for the invitation. Our team consisted of epidemiologists and analysts, and 2 of the analysts were veteran analysts working here for more than 10 years. So it's wonderful to take part in this kind of challenge, I say. And the question, just to answer your question about the hurdles that we had to navigate, I guess one of them, since the data is a private data and we had to maneuver through ethical and privacy approvals. And thanks to ISIS for putting up such a nice team to make that process easier. And then the technical side was dealing with the repetitions of tests within the modalities, especially when you have to consider the episode of tests being taken in care. That's all. I think overall it was a good experience.
Would you do it again?
Of course.
we like that kind of answer. So congratulations, and thank you for participating.
Thank you.
Great. So our next runner-up award goes to the Manitoba Primary Care Research Network from Winnipeg, Manitoba. And actually, this team was the winner of 2 of the runner-up awards. So you could actually win multiple awards, and these folks submitted some excellence for them and were winner of 2 awards. So big congratulations there. I believe we have Bill on the line.
Yep.
Bill, would you mind just describing a little bit about your team, and then I've got a question or 2 to ask you.
Okay, sure. MAPCRN is the Manitoba branch of the Canadian Primary Care Sentinel Surveillance Network, and we've been running for about 5 years now doing data extracts from primary care. Dr. Singer just took over as the network director here. I've been with it for 5 years, and the 3rd member was Sylvia Fraze, who's research assistant / take care of everything else that we ever possibly need.
Excellent, great. So you had some very fast submissions in that graph that Fraser presented earlier. You were some of the first blips along there. Can you tell us a bit about how long did it actually take you to conduct that analysis, and was it the right amount of time?
It was pretty quick. We had a further hurdle. I actually had to leave town the day after the competition started, so I did part of it from the airport here in Winnipeg. So you have a little more time would be nice next time. It was good.
Great. Okay. Thanks very much. Really appreciate it.
No worries. Pleasure.
Excellent work. And so our final runner-up winner is the Ottawa Hospital Performance Measurement Team. And I believe Nadine is on the line. Nadine, it looks like you have a huge team. So maybe if you could just quickly tell us who are all the participants on your team, and then I'll have a question for you as well.
For sure. So I've got a couple other team members here with me. You're on speakerphone, but basically in that picture we're performance measurement. We work for the Ottawa Hospital, and the person lying down in the front there is our big boss. So he's Alan Forster. He's the Chief Performance Officer here at the hospital. So our team consists of methodologists and some research coordinators. So that's pretty much us.
Excellent, excellent. And was it hard to get this whole team together, or not too bad?
No, not too bad. Most of us share 2 or 3 rooms, so we sit in cubicles type of areas, so we work collaboratively all the time.
Oh, great. Now, you folks answered a number of the questions as well, and were you surprised you had the data to respond to so many of them?
Actually, we weren't all that surprised. We have here at the Ottawa Hospital a data warehouse, which has been built for about 10 years now. So that's a data repository that brings in all the different data sources at the hospital together and links them together so that we can look at both administrative data and clinical data. And we know that it's the largest data repository of any Canadian hospital, so it really wasn't that much of a surprise.
Wow, wow. Well done and congratulations.
Thank you.
All right, so we have one last award, and that's when we took a look at the results from the judging. Apart from the speed scores, we saw there were some really excellent submissions that had not won awards, and so we determined that we needed to add an additional award for that top submission. So we've added what we're calling the Judge's Choice Award, and that award goes to the Lower Mainland Laboratory Services from Vancouver, BC. And I think we have Daniel on the line.
Yes, I'm here. Can you hear me okay?
Yes, we can.
All right.
Thanks for joining us. Do you want to tell us a bit about your team, and then I'll ask a question?
Sure. Well, I feel like we're like the scrawny kid in basketball shoes lining up on the front of the track because and basketball shorts because we're not a dedicated data analysis group. We're a couple of physicians who have an interest in lab utilization. So Andre Matman was really the person who encouraged the group to apply. Me, Dan Holmes, I'm a physician at St. Paul's Hospital also. Then we have Raphael Lim, who's the head of IT for Lower Mainland Labs, and John Andrzejczyk, who's sort of the big cheese at Lower Mainland Lab, and together we decided that we'd make a submission. I'm very glad we did.
That's excellent. Thanks so much. And I'm pleased you got your logo here. We don't need a picture because now we can all picture you standing around in your basketball shorts.
Yes, at the start line with people who are much better than us. So I'm just glad that we managed to squeak something out here because I feel like the other teams know a lot more about this than we do.
Oh. So our question for you is about what you plan on doing with these findings, and curious if you would be considering publication.
So for our findings, at this point we think they're preliminary. Our original idea was not that we would be making judgment calls about whether a test was useless or useful or not. We wanted to create a metric that we could follow to track ordering behavior, to see how often the order looks like it could be an unnecessary repeat, but not make a final definitive judgment call about whether we think it's unnecessary or not, because that requires chart review and a real thorough look. So our original conception was that we have something that you could track over time and look backwards, because we also have a data repository just for lab medicine data. We could look backwards and see, okay, is this metric climbing over time? This metric of repeat testing that looks like it might not be adding as much clinically. What we would want to do to take it to publication stage is perhaps add some statistical modeling around how much a test needs to change in order to be outside the range that you would possibly attribute to random analytical variation or biological variation within the patient. That is, we would want to be sure that the test adds no new information from the kind of Shannon information theory perspective, and there's approaches for that. So that's what we would want to add before we would be interested in publishing, and it's certainly something we can do.
Great. Thanks a lot. That's a really excellent answer, and really gets to some of the things that Fraser and I will talk about as we close this off in terms of what are the next steps now that we've got this sort of first set of analyses in. So thank you so much, Daniel. Really appreciate your submission.
Thank you, and for putting up the contest, and we're just delighted to have participated.
Great. Well, I understand Ahmed is on the line now, and Ahmed, if you can unmute yourself, we want to take this opportunity again to congratulate your team.
Hi, yeah, can you hear me now?
We can. So congratulations, you guys are the first place award recipients. Ahmed, tell us a bit about your team, who was on it, and kind of what backgrounds did they come from?
So we have 6 individuals, 3 physicians, 1 nephrologist, and the other 2 are urologists. And we also have 2 statisticians, and myself, I am an epidemiologist. So together we come from very different backgrounds, and we made a fantastic team.
Excellent. Excellent. And so I think you answered one of the questions around repeat tests. Is that correct?
Yeah, so we looked at cross-sectional imaging tests and percentage of repeats within 90 days.
Okay. And so what did your findings about rates of repeat, did your findings surprise you?
So just to give people on the line a little background, so we looked at CT and MRI of head, chest, and abdomen, as well as ultrasound of the abdomen and pelvis. And we looked across all individuals in Ontario who got a repeat test in calendar year 2013. So we found about 7.1 million imaging tests done that year for those specific images or those specific studies. And of those, 13% were repeated. So that's about 900,000 repeated tests. And we also looked at a subsection of Ontario. So that's 11 hospitals in Southwest Ontario that share a linked online radiology system. And this system allows physicians to access radiology reports and actual images from those studies. And we just want to see if that linked system reduces the proportion of repeat tests. We found about 245,000 imaging tests, and about 27,000 were repeated, so that's 11%. So in a way, the use of repeat tests wasn't very surprising, and that's because sometimes those tests or the tests are done without the proper imaging protocol, or the results raise new questions that require additional follow-up. But what was interesting is the differences in the proportion of repeat tests between the subpopulation we looked at with linked hospitals in Ontario. So now we're actually looking deeper into that question, and we're looking for funding, and that we're planning to grants for that to investigate a little bit more.
Well, great. Thank you very much for your submission, and congratulations again on your award. So a final congratulations to all the reward recipients and also to all the participants. Good job, everyone. As Simon said, we're going to close off this webinar with a few next steps. And so first of all, to let you know that all submissions are now posted on the Challenge microsite, so that's imaginationchallenge.ca. Of course, we want you to encourage to share your results and definitely publish them if you can. That'd be excellent, especially with this new way that we've uncovered of sort of unleashing your data.
And so the next set really sort of gets to some of the things that some of our teams were just discussing now, which is that some of these questions, some of the answers that's in the submissions pose additional questions. They cause us to look at them and think, okay, how do we need to dive into this a little bit more? What have we learned from this and what is left to learn? And so our intention is to move forward with a webinar series that explores these. So the idea is that we would have a webinar on each of the questions that received a substantive number of submissions, share those findings, have some of the top judge teams present on what they found, and then have a facilitated discussion with folks that are interested in participating from across the country on what we've learned, what are the things that we don't know, what are the limitations to the methodology, and how can we move forward to fill those gaps and share the information that we have. So that's the plan. Absolutely, all of you on the line will receive notification as we start to launch those webinars, and we want to encourage folks across the country to join those, participate in those, because those really will be a forum for discussion and debate for everybody on the line, where we can can dive into the details and talk about where to go from here. And so that's it for the day.
Yeah, so definitely, as Simon said, we'll be sharing you information about those upcoming webinars, so stay tuned. I think that'll be exciting content, especially for the teams involved that answer similar questions. To hear each other's thinking on those will be great. So we're going to close off this webinar. I want to again say thank you to all. So thank you to the participants, thank you to our award recipients, thank you to the judges. Also, thank you to all of our supporting organizations, and I want to give a big thank you to the team here at Infoway that helped pulled off this challenge as well. So good job, everyone, and we hope to hear you, all of you, again on the upcoming webinar series. Have a good afternoon.
Thank you again for joining us today. This concludes today's web conference, and you may now disconnect.